I have learned acupuncture, very pragmatic Chinese approach, and a lot of trigger point acupuncture, which includes palpation of trigger points, but also microsystem acupuncture, which, for example, ear acupuncture, where you have to detect points by dabbing or looking for sensitivity of spot. So we just left a little bit the only theoretical background, so we can back to the person, to the organism, to the body, to ask the body and to examine the body where are reactive spots at the ear and trigger points. And then I experienced what Joe Odette was practicing in this course. This was Japanese acupuncture, palpating and putting a needle and having a look if the sensitivity of spots changed. So you don't ask the patient, do you have pain? I treat, is it better? So you go more direct. You ask the body, is it sensitive? You put a needle and then you control for. And there was a parallel how I was treating trigger points or a microsystem acupuncture by looking for sensitive spots. And Joe and his group, they did it on the Hara diagnostic, on the abdomen. So there was a parallel. And I experienced this, and then there came a question up, why? Different kinds of acupuncture, different approaches of acupuncture lead to the same result, which is an improvement in symptoms of patients. And the characteristic was the body talk. You talk to the body. You have to know that nowadays the ratio is influenced by so many things, by your parents, by the society, by your understanding of life. So if I ask a patient, why do you have headache? He gives a very rational answer, but he does not come to the ground because the ratio is not the only explanation. So how can we deviate this brain, which is fixed with ideas, with some wishful thinkings and so on? So we have to go directly at a deeper level. And this is what happened in Japanese acupuncture and in microsystem myofascial trigger points examination of the patient. And then I said, there must be a common sense. There must be something common in these different approaches to get into contact with in a deeper, maybe just on the stem brain and this deep level. And what I have learned with the Japanese acupuncture, and this is really fascinating, it's just to get into contact with palpate. This is just what I explained, and I saw, okay, they're coming to the point, and they provoke a deep change in the, I don't know how to call it, in the awareness of disease, in the perception of disease, in the coping with symptoms. And so this was very helpful and very interesting, and this is the reason why I am really fascinated by this Japanese system, and I'm very fascinated how Joe and his colleagues are teaching the students. So it's really high quality because at the same time they keep the scientific level very high. So if you fulfill this course, you are able to argue on a rational level, but you also experience some very deep moments and very deep changes in patients who are suffering or who have disabling diseases. So, I still don't understand what's happening. I'm doing this now for 25 years, 30 years, but still it's a miracle, but it works. And this is really, really incredible.